Section 1. A compromised defense, AIDS, and the immune system. The human immune system is a complex and remarkable defense network. It is composed of various cells, tissues, and organs that work in harmony to protect the body from harmful invaders. This system is our body's natural defense mechanism, designed to identify and neutralize threats such as bacteria, viruses, and fungi. The immune system is constantly on alert, ready to spring into action at the first sign of danger. It protects us from a constant barrage of harmful invaders like bacteria, viruses, and fungi. These pathogens are everywhere, and without a functioning immune system, our bodies would be overwhelmed by infections. The immune system's ability to distinguish between the body's own cells and foreign invaders is crucial for maintaining health. However, certain diseases can weaken this intricate system, leaving us vulnerable to a host of infections. When the immune system is compromised, it cannot effectively defend the body, leading to increased susceptibility to illnesses. This can result in frequent and severe infections, prolonged recovery times, and a general decline in health. Acquired immunodeficiency syndrome, more commonly known as AIDS, is one such disease. AIDS is a chronic, potentially life-threatening condition that represents the most severe phase of HIV infection. It severely damages the immune system, making it difficult for the body to fight off infections and certain cancers. AIDS is caused by the human immunodeficiency virus, or HIV. This virus attacks the body's immune system, specifically the CD4+ T cells, which are a type of white blood cell that plays a critical role in maintaining a healthy immune response. Without these cells, the body becomes increasingly vulnerable to infections and diseases. This virus specifically targets and destroys a type of white blood cell called CD4+ T cells, which are crucial for a robust immune response. CD4+ T cells are essential for coordinating the immune system's response to infections. When these cells are depleted, the immune system's ability to function properly is severely compromised. As HIV multiplies, it progressively weakens the immune system, making it difficult for the body to fight off infections and diseases. The virus replicates rapidly, and over time the number of CD4+ T cells decreases, leading to a weakened immune system. This gradual destruction of the immune system is what ultimately leads to the development of AIDS. This weakened state is what we call AIDS. When the immune system is no longer able to defend the body effectively, the individual becomes susceptible to a wide range of opportunistic infections and certain types of cancers. These conditions take advantage of the weakened immune system, leading to serious health complications. People with AIDS are highly susceptible to opportunistic infections. These infections are caused by organisms that usually don't cause illness in healthy individuals but can take advantage of a weakened immune system. Opportunistic infections can affect various parts of the body, including the lungs, brain, eyes, and digestive tract. These infections are caused by organisms that usually don't cause illness in healthy individuals but can take advantage of a weakened immune system. Common opportunistic infections include pneumocystis pneumonia, Kaposi's sarcoma, and cytomegalovirus. These infections can be severe and even life-threatening for individuals with AIDS. One of the areas where these opportunistic infections often manifest is the mouth, leading to a variety of oral health problems, including the development of a white tongue. Oral health issues are common in individuals with AIDS and can include thrush, oral hairy leukoplakia, and severe gum disease. These conditions can cause pain, difficulty eating, and further compromise the individual's overall health. Section 2. Beyond the surface, symptoms of AIDS. The symptoms of AIDS can be varied and often depend on the specific opportunistic infections a person develops. Some common symptoms include persistent fever, night sweats, chronic fatigue, unexplained weight loss, and swollen lymph nodes. However, it's important to remember that not everyone with HIV will experience all of these symptoms, and some may not experience any noticeable symptoms for years. In addition to these general symptoms, people with AIDS are prone to a range of oral and throat problems. These problems can include painful sores in the mouth or on the tongue, difficulty swallowing, dry mouth, and a white coating on the tongue. This white coating, often referred to as white tongue, can be a sign of various underlying conditions, many of which are directly linked to the compromised immune system of someone living with AIDS. Section 3. White tongue, a telltale sign. White tongue, characterized by a white or grayish coating on the surface of the tongue, is a condition that can be alarming at first glance. This condition can manifest in various ways, from a light, patchy appearance to a thick, uniform coating that covers the entire tongue. In many cases, white tongue is often a benign and temporary condition in healthy individuals. It can be easily managed with proper oral hygiene practices, such as regular brushing and staying hydrated. However, it can be caused by a variety of factors. Dehydration is a common culprit, as a dry mouth can lead to a buildup of dead cells and bacteria. Poor oral hygiene, smoking, and even certain medications can also contribute to the development of a white tongue. In some cases, white tongue can be a sign of a more serious underlying condition. For instance, in people with AIDS, a white tongue can indicate a more severe issue. This is because their immune systems are compromised, making them more susceptible to infections and other health problems. The white coating seen in white tongue is often a buildup of bacteria, dead cells, and food debris that get trapped between the small nodules on the tongue's surface. These nodules, known as papillae, can become inflamed and enlarged, creating a perfect environment for these substances to accumulate. When the papillae become inflamed, they can trap more debris, leading to a thicker coating. This can cause discomfort and even bad breath. It's important to address the underlying causes to prevent the condition from worsening. While this buildup can occur in anyone, it's more common and often more pronounced in people with AIDS due to their weakened immune systems. Their bodies are less able to fight off the overgrowth of bacteria and fungi that can contribute to white tongue. This is because their bodies are less able to fight off the overgrowth of bacteria and fungi that can contribute to white tongue. Regular dental checkups and maintaining good oral hygiene are crucial for managing this condition, especially for those with compromised immune systems. If you notice a persistent white coating on your tongue, it's important to consult a healthcare professional to determine the underlying cause and appropriate treatment. Section 4. Opportunistic infections, taking advantage of weakness. Opportunistic infections are those that take advantage of a weakened immune system, causing illnesses that would not normally occur in a person with a healthy immune system. These infections are particularly dangerous for individuals with compromised immune systems, such as those with AIDS. As mentioned earlier, people with AIDS are highly susceptible to opportunistic infections. This susceptibility is due to the significant weakening of their immune system, which is unable to effectively fight off infections that a healthy immune system would typically manage without issue. The immune system's primary role is to protect the body from harmful pathogens, but in individuals with AIDS, this defense mechanism is severely compromised. These infections are a significant concern because they can lead to serious complications if left untreated. Opportunistic infections can affect various parts of the body, including the lungs, brain, eyes, and digestive tract. They can cause a range of symptoms from mild discomfort to severe life-threatening conditions. The impact of these infections on the overall health and quality of life of individuals with AIDS cannot be overstated. When it comes to white tongue in people with AIDS, several opportunistic infections are often the culprits. White tongue is a common symptom that can indicate the presence of an underlying infection. It is important to identify the specific cause of white tongue to provide appropriate treatment and prevent further complications. One of the most common culprits is oral thrush, also known as oral candidiasis. Oral thrush is a fungal infection that occurs when the Candida albicans fungus overgrows in the mouth. This condition is particularly prevalent in individuals with weakened immune systems, such as those with AIDS. This fungal infection is caused by an overgrowth of the Candida albicans fungus, which is normally present in small amounts in the mouth. In a healthy individual, the immune system keeps this fungus in check, preventing it from causing any harm. However, when the immune system is weakened, as in the case of AIDS, the fungus can multiply unchecked, leading to infection. In healthy individuals, the immune system keeps this fungus in check. The body's natural defenses are usually sufficient to prevent the overgrowth of Candida albicans. However, when the immune system is compromised, it loses its ability to control the growth of this fungus, resulting in oral thrush. However, in people with AIDS, the weakened immune system allows the fungus to proliferate, leading to the development of white, creamy patches on the tongue, inner cheeks, and sometimes the roof of the mouth. These patches can be painful and may cause difficulty in eating and swallowing, further impacting the individual's health and well-being. Another opportunistic infection that can cause white tongue in people with AIDS is oral hairy leukoplakia. This condition is characterized by the appearance of white, hairy-looking patches on the sides of the tongue. Unlike oral thrush, oral hairy leukoplakia is usually painless, but it can still be a cause for concern. This condition is caused by the Epstein-Barr virus, the same virus that causes mononucleosis. The Epstein-Barr virus is a member of the herpes virus family and is one of the most common viruses in humans. In individuals with a healthy immune system, the virus is usually kept in check and does not cause significant problems. However, in people with AIDS, the weakened immune system allows the virus to reactivate and cause oral hairy leukoplakia. Oral hairy leukoplakia appears as white, hairy-looking patches on the sides of the tongue and is often painless. While it may not cause discomfort, it is an indication of a weakened immune system and the presence of the Epstein-Barr virus. It is important for individuals with AIDS to receive regular medical checkups to monitor for opportunistic infections and receive appropriate treatment to manage their condition. Section 5. The link between AIDS and white tongue. The prevalence of white tongue in people with AIDS highlights the interconnectedness of the immune system and oral health. A healthy immune system plays a crucial role in keeping the balance of microorganisms in the mouth in check. However, when the immune system is compromised, as it is in AIDS, this balance is disrupted. This disruption allows opportunistic pathogens like Candida albicans and the Epstein-Barr virus to multiply unchecked, leading to infections that manifest as white tongue and other oral health problems. The weakened immune response in people with AIDS also makes it more difficult for their bodies to fight off these infections, allowing them to persist and potentially worsen over time. Therefore, the presence of persistent white tongue in someone with AIDS should not be ignored. It's a visible sign that their immune system is struggling and that they may be dealing with an underlying opportunistic infection that requires medical attention.